Thank you, Mr. Chairman. I very much appreciate the work that you have put in here over the last few months to try to advance the conversation across in a bipartisan way. I know that January 1, whether we say it's 12 days, 30 days, we have a time crunch because there are, it's interesting to me because if you don't work, you get free health insurance in this country, but if you do work, you're getting screwed right now. It's just not fair for people who are trying to do it the right way, who are working. And I have a fresh approach to this because I was not here when the ACA was created. I was not here when the tax credit COVID subsidies were implemented and scheduled for expiration. But I do see a lot of Americans, and I've talked to many of them, who don't care whether the Democrats created the problem or the Republicans created the problem. They just want their government to fix it. They just want their government to help them. And we have a few days to prove that we care, that we're going to try. And it is frustrating. And I know we could do this because Senator Hassan and I had the Smart OTC Act, which was a bipartisan effort to help make it easier to take prescription drugs and make them over-the-counter drugs, and we got that done here in the last few weeks. That's just one small step. There are a dozen small steps or even moderately successful steps that we can take to reduce the overall cost of health care in this country. It's the number one driver of inflation in the 21st century. It is a burden on small businesses and ratepayers. And I've proposed recently just a simple start to this. I called it fraud, freeze, and fix, because we know in the system as it is right now, the zero premium plans are susceptible to fraud because insurance brokers who've been prosecuted for this sign up people who don't even know they're being signed up, siphon off hundreds of millions, billions of dollars of money that go to the insurance companies and never actually cover a person. So we can fix that. That should be something everybody, even if it's just $1, to say, hey, I'm a real person and this is a real policy and we're going to eliminate the fraud. And we can freeze the subsidies where they're at right now for a temporary period of time. I don't know if that's 1 year, 2 years, to help give some relief. And by the way, just because we continue those tax credits does not drive down the cost. It transfers the burden to the taxpayer and future generations. But it is a little help right now that we both can agree on. And then we got to fix it. And there are at least 5 to 10 really solid pieces of legislation that I know have some bipartisan support that we could tackle to prove that we're serious about driving down the overall costs. And that's what I hope we'll do. That's what I hope we'll do, because there are a lot of people out there. I talked to a gentleman recently. He makes $83,000 a year. He doesn't want government insurance. He said, I don't want but he said, but the government created this problem. I have one plan to choose from. One plan. It's all I can get in my little rural community, and it's going to cost like almost a third of his salary to pay for it all. Plus, has a huge deductible. That's what the government did to people. The ACA and other things. And again, we can start fresh. We just got to get better. Like it's going to be a piece at a time. It's going to be a moment in time. And we have a lot of ideas. I know I'm going to run out of my time here to be able to do this, but I'm going to introduce soon a Healthy Competition for Better Care Act that enables more group health plans and health insurance insurers to ensure agreements that providers to guide enrollees for high-value providers. And like literally we have contracts that people enter into that say, no, you can't tell people about a better deal. I mean, seriously, that's what we allow in this country. We don't allow real consumers in shopping and healthcare. And so I guess I'm out of time, but how's that sound to you, Mr. White?
Go get them. Sounds good.
Thank you, Mr. Chairman.